My name is Ben Tisdale. I'm 71 years old. I live in Anchorage, Alaska. I'm also a victim in the year 2000 of not having electronic health records because I'm legally blind. You see, I had atrial fibrillation. My heart was skipping a beat. And they put me on 400 milligrams of amiodarone. I lost my first optic nerve in my right eye 4.5 months after they started me taking this medicine. 4 months later, the medicine killed my optic nerve in my left eye. I then went to a neuro-ophthalmologist down in San Diego who told me that they had made a mistake. They should not have given me that 400 milligrams of amiodarone because it counteracted and multiplied the medicine I was currently taking. Had EHR been available, none of this would happen, and I would be sighted today. I'd have my sight. As the minute they put it into the computer that they had given me 400 milligrams of amiodarone, the computer, all the bells and whistles and red flags and everything would have came out showing that there was a conflict in these medicines. Hopefully that'll never happen again to anybody else. That is why we need to have electronic health records here in Alaska.
Electronic health record is a means using information technology of replacing the paper health record, an example of which I have here. The electronic record is a means of capturing all of this data on a computer and the ability to transmit it from one physician practice to another.
Using electronic health records is now becoming the standard of care. It also lists medicines and where those medicines go and what pharmacy. If we have problems, we want to know where those are going, and we need a way to organize that.
I can give you one example where there were probably numerous lives saved by virtue of a facility or an agency having an internal electronic record. And that would be the Veterans Administration as a result of Hurricane Katrina. But they were able to transmit their records, which were electronic health records, over to a new facility in San Antonio and didn't miss a beat.
I wound up now taking care of 4 different people with dementia, becoming their legal guardian or their medical power of attorney and going to their appointments, visiting them in the hospital, rushing them to the ER. I realized over and over again the real need for finding some way to transfer records, to easily assess records, to have records indexed.
If I'm coming into a physician practice, a new doc, and I forget to tell them what I'm taking, it may have been prescribed or I may have been taking it for years as an over-the-counter thing and it just slips my mind. That doc writes me a prescription for something and sends it to a pharmacy. An electronic health record can match that doc's prescription on whatever I've been on over the past years and ask the question. So that's technology intervening in the frailties of human memory.
My long-standing doctor retired. This had happened to me once before in the many years I've been in Alaska, but in this occasion I was on Medicare as I hadn't been before. I found they sent me a letter showing 2 physician's assistant and the neighborhood health clinic as my only options.
There are a lot of folks out there in this state who get that same kind of letter as they approach that magic age of 65, and the docs say, sorry about that, we won't take Medicare patients. And these people are out there not knowing what the heck to do.
I got up my courage and wrote a letter to the doctor of one of the people I'd helped. So I wrote her a pleading letter. If she'd just give me a physical once a year and take me as a patient. I cried when she told me yes. I was so relieved.
Primary care physicians are in a critically low number. And there have been efforts to recruit more to come up here. And one of the first things they ask is, do you guys use electronic records up there? And when the answer is no, it's a turnoff, and we have lost opportunity to recruit new docs. What electronic health record will mean to the medical community is the assurance on the part of that doc that he's seeing everything he needs to know about that patient in order to deliver quality care, in order to do the best he or she can for a positive outcome.